Hello and welcome back to Dental Chat, where we are continuing our look at the various dental specialties available to dentists in Australia. There's 13 of them, and today we're looking at special needs dentistry. And we have the great pleasure of talking to Dr Mathew Lim, a special needs specialist. Welcome back. This chat is part of the ongoing series that we're doing, looking at the different dental specialties in Australia, of which there's 13 of them. And today we're looking at special needs dentistry, an area that I find particularly interesting, simply because I think a lot of dentists aren't exactly sure on what a special needs specialist can do and what they do on a daily basis. We all have a very clear picture of an endodontist, prosthodontist, exactly what they do when we refer to them. But I am very much looking forward to hearing about special needs dentistry. So today I have the absolute pleasure of talking to Dr Mathew Lim, a special needs dentist based in Melbourne. And so welcome, Mathew, and thanks for joining us.
No, thanks for having me. Thanks for the invitation.
Now, what I hope to do here is give dentists and dental students a good idea on what it's like to become a special needs dentist and also to get an understanding of what it's like on a day-to-day basis. But before we do that, can you just tell me a little bit about your current position, where you are, what you're currently involved in?
Sure. So I guess in summary at the moment, I work as a specialist in special needs dentistry in Melbourne, Victoria. I split my time between academic roles at the university and some clinical roles. The clinical roles that I hold are at some of Melbourne's major hospitals. So I work as a dental specialist at the Royal Melbourne Hospital as part of their wider oral and maxillofacial team. But I also look after the dental team at the Alfred, which is, I guess, the other sort of major hospital in Melbourne, where I not only work there as a specialist, but I also am director of that service. From an academic point of view, I work at the University of Melbourne, at the Melbourne Dental School. That role involves some teaching as well as research. The teaching roles that I have are divided amongst coordinating the final year of the dental program here at the Melbourne Dental School. And I'm also a senior lecturer and convener of the special needs specialty program as well.
Okay, well, thanks for that. And in fact, on top of all of that, I've read your CV. You're involved in so many different things that we don't have time. That'd be a lecture in itself, a whole talk in itself. But we actually met at the Therapeutic Guidelines. We're both in the writing party for the next edition of Therapeutic Guidelines, which has taken a fair bit of time, but it's also very interesting as well. So look, before we delve into how you became a special needs dentist, I want to, as I said earlier on, get into the nitty-gritty of exactly what special needs dentistry is. I don't normally need to do this for a specialty to define it, but in many people's mind, including mine, I suppose the idea of special needs dentistry was always someone with some physical problem that made it difficult to get treated in a normal dental practice. But the term special needs encompasses such a wide area. Can you explain what exactly is special needs and what does special needs dentistry cover?
So I guess the way that I like to look at it is that we fill a bit of a gap that exists between dentistry and a lot of other areas of healthcare. Often our only connection or our main connection with the medical profession is largely through the oral and maxillofacial surgeons, I guess to a certain degree oral medicine specialists now, but we don't have that sort of connection with a lot of other aspects of the healthcare system. So we as dentists, we're very good at working independently, and we do tend to sometimes silo ourselves from other sort of areas of healthcare. And it's sort of bringing that dentistry back into the aspect of health. If we look at the really strict definition of special needs and how it's defined by AHPRA, the Dental Board, the ADA and other organisations, is it sort of covers quite a diverse group of people, as you were saying, Steve. So the main groups of people are those with significant physical disabilities, are those with intellectual cognitive disabilities, people that have complex medical problems or medications that might affect their dental care, those with significant healthcare, I guess some mental health problems, as well as to a certain degree those within the aging population. And it's not necessarily that because you have any of those things that you automatically need to see a specialist in special needs dentistry. Is what it is that often those individuals need particular treatment plans to adapt to their care, or may need additional measures or expertise to help guide the more complex parts of their care. And so that's largely the job that we do. It very much is an extension of general practice in that space, but fills the sort of really interesting gap and quite a dynamic gap that otherwise sometimes exists in our dental profession.
Right. Yeah, that's a good explanation. So special needs dentists, do they mainly work in the public system? Or, I mean, they are available, obviously, for dentists to refer to in private practice, but a lot of what you've said there seems to mean to me that it's the type of patients that we just don't feel comfortable treating in private practice, that we want them to be treated in somewhere that has larger facilities, maybe in case of emergencies, very things.
So, I mean, yes and no. I think that when often when I joke about special needs dentistry, I think that the whole idea behind the specialty was that it sort of is a little bit the too hard basket. It's the things that are challenging or that people don't like to do. When I sort of see it from a very different perspective of actually us trying to bring back, I guess, oral health into the space of general healthcare and to look at it from that perspective. I think that you're right. For a lot of the patients that we do see that have quite complex needs, for a number of different reasons, they are more suited to be treated in the public sector. Part of that is because often we see in these populations that with a number of different areas of disadvantages, that part of that becomes a socioeconomic type disadvantage from a financial perspective. That means that they may be more inclined to be treated in that sector. Another aspect is that some of them have quite complex and challenging medical needs, which means that it's more suited to be being in a public facility in a major hospital to provide that care. But I think the misconception is that patients with special needs, if we put it under that general title, want to be treated in the public sector. There are many specialists, myself included for a long period of time, that work in private practice. And a lot of patients choose to embark on treatment in that sector because they have the choice of how they receive that care and what type of care they receive. I think that because we're still a relatively young specialty, naturally it does develop primarily from the public sector. But there are most certainly opportunities across both the private and public sector for dentists to work as a specialist in special needs dentistry.
Okay. How many special needs specialists are there?
So I think the last time I checked, which was just a few weeks ago, I think there are 29 registered specialists in Australia.
Oh, that's not many. Is it kind of the smallest number of specialists in any specialty?
By far, and it's sort of been a really interesting journey because we have had sort of these waves of specialists training, I suppose, in our field. But quite often we're not training people quick enough to manage those that are sort of hitting retirement age. So it is we have plateaued around this sort of number of 30. It is a marginal increase, and it's definitely a big increase from where we started from. But there's still a lot of space to grow. A good example is that in the UK, where they also have the specialty of special care dentistry, which is very similar. In the same period of time that they've had a specialty, which is about the same as us, about 2 decades, they have over 300 specialists that are registered in the UK. There are definitely challenges within our system, but I think that there are great opportunities now for us to be able to break down those challenges to kind of grow this area in the sector.
Okay, well, thanks for that. That's a great explanation of special needs dentistry. So, look, let's go back a bit. Let's go back to before you even started doing dentistry. Where did you kind of live? Where did you go to school? And how did you decide to go into dentistry?
Yeah, so I guess my story is, I think, pretty interesting, is that we, as a family, spent a lot of time moving around when I was younger. So I was born here in Melbourne, but then because of my dad's work in banking, is that we moved around a number of different places. We spent a bit of time in New Zealand, spent a bit of time in Melbourne, spent a bit of time overseas before we came back to settle in Melbourne for me to do high school. So I went to school here in Melbourne at St. Kevin's, then sort of embarked thereafter to do dentistry in Adelaide. So it's been sort of an interesting journey to go through. To answer your question about, I guess, how I got into dentistry, it probably, I'll be honest, it definitely wasn't the first thing on my mind when I was thinking about it. I was very fortunate to have a family friend who asked me very early on when I was sort of just starting high school about what I'd like to do when I finished high school. And, as a 12 or 13-year-old, you really hadn't thought about it. But what it was a really good impetus to do was to really start thinking about what my options were really early. And I spent a lot of the summers throughout high school is doing different areas of work experience. So I went and spent time with a family friend who was an architect. I went and spent time with a number of different people. The area that really, strangely enough, resonated with me was dentistry because it was a combination of the things that I wanted to do. I didn't want to be necessarily working alone. Having said that, I think that I am, or most of us who are dentists are inclined to sort of to like to work in that environment where we have a lot of control and we can sort of influence change. I really enjoyed sort of science, biology, and those aspects of things. So But at the same point in time, I didn't want to focus entirely on research. I wanted something that felt hands-on and where I could interact with people. So naturally, it sort of pulls you in a particular direction. The thing that really made a difference for me and why I embarked on dentistry was that it felt like an area where I could affect change very, very quickly. One of the things that we have a really unique opportunity to do as dentists is that a patient can come to us with a particular problem on a day. And often is that we, within half an hour, can come up with a solution where they feel a lot better at the end of that appointment. It's something that's very unique in the space of healthcare and something that, I find really fulfilling and have found fulfilling for the whole of my dental career, both as a general dentist and a specialist.
Okay. When did you start thinking about special needs then? Was this something that was occurring whilst you were doing uni?
I went through the dental program in Adelaide. It was on my radar relatively early because it was at the time that special needs dentistry had just been registered as a specialist. So at the time,
What year was that, by the way?
It was fully recognised as a specialty somewhere between in the sort of the mid 2000s.
Right.
So it was about the time that I was going through dental school. It was a little bit visible to us because of quite a well-established special needs unit at the Adelaide Dental Hospital under the sort of the stewardship of Liz Coates at that time, who was a really amazing, strong personality and advocate in that particular area. Also, it was the time when Sharon Liberali was one of the first sort of specialists doing her declin dent at that time. Funny story is that I didn't really get that much of an experience while I was going through dental school. Anyone who's trained in Adelaide knows that there's usually a final year placement where you work at the special needs unit, and you often apply to do so. So I was, very keen to do it, applied, and ironically, I didn't actually get a position to do so. So it was something that sort of set back that interest for a while. But as is the case with a lot of specialists in special needs dentistry, is that there's often something personal behind it. There's often a personal pull, whether it's because of a family connection, something within your life that sort of pulls you in that particular direction. And naturally, as the case in your early dental career, things pull you in a particular way. And so even though I embarked on doing general dentistry and never having an intention of going back to study again, naturally over the years thereafter, something kind of pulled me in that way.
Right. So you graduated and then you're working in private practice. How long were you working in private practice, and what was this thing that pulled you in this direction eventually?
Yeah, so it was a great question. So one of my final year placements that I did was down in Tassie. So I actually went down to work in Hobart for the first few years after practice. I worked full-time for my first year in private, and then sort of worked a mix of private and public at that stage. I think one thing is that in the private practice that I worked at is that the principal dentist at the practice was very, very quick at what he was doing, was a Scottish dentist who was a prosthodontist and was very, very quick with his patients. And at that time, I was afforded this great opportunity to be able to spend time with my patients and to take my time to sort of build that up. And so naturally, we saw kind of different groups of patients. He would see those that were just no fuss, want to come in, get something done quickly and go with no chat. Whereas I tended to get the patients who wanted to spend a little bit more time. And often those were the ones with the more complex needs, that were more anxious, that had more questions, that wanted the reassurance and those things. Is that with time that naturally, I think that I found that I was seeing more of those patients, both in private as well as in public. In the public system, obviously, you have a lot of patients that come in with a number of other sort of social factors. You see people with disabilities, much more complex needs. I was asked to work down at the hospital in Hobart, so naturally I saw that and did GAs. Strangely enough, is that while people would think it's that it was the I guess the interest in these patients that would have sort of really pushed me in the direction, it was actually of specialising. It was actually the uncertainty. It got to the point where a larger proportion of the patients that I was seeing had complex disabilities or complex medical needs. And I started to become really insecure in what I was doing. I started to question what I was doing. I spent a lot of time researching the patients, and it was something that I had a great deal of pleasure in doing, in trying to encourage myself to be as informed as I was. But I always had this insecurity at the back of my mind that I wasn't doing the best by them, and could there be someone else that was doing better? So part of the reason that I chose to go back and specialise in special needs dentistry was because I had this whole group of patients that I was seeing, and I wanted to know that I was doing the right thing for them, and I wanted to do the best by them. And it was just one of those fortuitous things. I remember thinking about it, getting a leaflet in the mail in the ADA magazine with this very clear from the University of Melbourne saying that they were accepting applications for special needs dentistry for that year. So, it was one of those situations where those sliding door moments where, you could have thrown the magazine out and never looked at it. but it just happened that I opened it up, I saw it there, it was enough of a reason to apply. And within 2 weeks, I had an interview and had been offered a position to come back to Melbourne. So it was a great opportunity to come back to Melbourne as it is, but it was also a great opportunity to follow a passion, and really, really enjoyed the journey that I've gone through.
Isn't it amazing? Those little things that can occur in life can lead you in totally different directions. That
Absolutely.
one little pamphlet, yeah, that's quite amazing. Now, you touched on a couple of things there about general anaesthesia and sedation, and I suppose with the population that you're seeing, that's an important aspect. But I suppose you also want to keep in mind you don't want to necessarily just use chemical restraint unnecessarily, but of course these modalities of IV sedation, for example, and GA are required sometimes. So could you talk a little bit about that?
So I think it's a really interesting topic and quite a controversial one at this point in time, particularly following out from the Royal Commission in disability and health, and how we look after and care for people with disability in Australia. One of the key outcomes of that Royal Commission was that, and I think the Aged Care Royal Commission as well, is that chemical restraints, so things like sedation, are overused in a lot of healthcare settings. What that's led to is a lot of advocacy from the disability sector to try and push back against those modalities. And I think reasonably so. As you were saying, Steve, is we want to make sure that what we're doing is within reason. I think what's really important for us in special needs is being able to have as much opportunity to have access to modalities to be able to provide the best care that we can for our patients. It shouldn't be about choosing to do on something under sedation or general anesthetic to make it our job easier because a patient is asleep and then we don't have to worry about them. What it really needs to be about is what is going to be best to help that patient cope with that care at that point in time. It's unfair to expect that someone with a disability has their, wisdom teeth out, surgical wisdom teeth out under local anaesthetic just because they have a disability, when we wouldn't expect that for someone without a disability. So I'm a very strong advocate to make sure that we have those modalities still available to us, despite these conversations and within reason. And a lot of that comes down to the individual clinician being able to make that reason and to understand what the patient's needs are at that point in time and what is the best way to achieve that care.
Yes, I think it's such an important area, and you've summarised all that beautifully. One of the problems, though, of course, is access to GA, for example. I know it's getting more and more difficult. Private hospitals are a business. They're looking at the amount of rebate they get from a health fund, and unfortunately, dentistry is not high on that. So I think that it's getting harder and harder. Is that the case?
Absolutely. I mean, is that, and this is not limited to special needs. It's most certainly across paediatric dentistry as well as starting to spread to oral max facs as well, and the way that they're affected. We've seen it completely across the general profession. And I think that you're right. One aspect of it is most certainly the funding model behind it. But what we're starting to learn from, I guess, the advocacy and work that we're doing across our specialties is that it's a much more complex picture than that. A good example is that in many states, as dental wait lists are not reportable to sort of governments. And so when we see governments spending lots of money dedicated to reducing wait lists, none of that ever goes to dentistry because no one knows where those wait lists are. As a result, we have wait lists that often blow out quite significantly and people are not getting the timely care that they need. And as a result, we know that obviously oral health affects the quality of life of these people. It's just harder when for patients that I see with a disability because they don't have the same ability to advocate as necessarily a child who has a parent to advocate for them or someone else who can speak for themselves. A lot of the time, these are individuals who sit quietly on wait lists, who sit there still suffering and not able to advocate for themselves. And then we sort of have the deleterious effects of that when we have to go and do really significant interventions. So I think it's a really important issue at this point in time. I know there are a lot of people that are working on it. And I'd encourage anyone who is experiencing these types of problems is to speak to sort of peak organisations like the ADA and to bring forward stories so that we can truly advocate to try and address this and sort of bring that balance back so that we all feel, regardless of whether you're a specialist or not, is that we all feel capable to be able to provide the care that people need in a timely and most appropriate way that we can. And most of all for those that are the most vulnerable people in our community.
Yeah, I certainly know that access to GA for patients is certainly something that's high on the list for the ADA Advocacy Committee. Okay, back to your actual postgrad course. If someone was interested in doing special needs, what would you say to them about the course? Is it difficult? How do you fund yourself during that time? Is there any certain elements of it that you think people should know about?
So this is a really interesting question because I have the fortune of not only visiting it from the point of view of my own experience of having gone through the training, but now I also sit in the position of of running the course that I did. So a big aspect of this is reflecting back on my own experiences and the experience of those that went through with me to try and improve and address a lot of those issues. I think that's the big thing that I would highlight for most people if they were thinking about specializing in special needs dentistry is that we always encourage people to have a really strong background in general dentistry. Because special needs is such an extension of general dentistry in a very complex population, is that having those basic skills down pat is a really vital thing to be able to treat more complex populations. I think that there's a growing pool of universities that are offering courses. I think that what is really challenging from the point of view of a convener is expecting people to give up their full-time work to come back and study and to commit to studying and to be able to fund that over a period of time. There are sort of, for Australian citizens and residents, there are government supports in terms of loans that you can provide, and those are very, very helpful throughout. We're also trying to find ways to make it more sustainable so that students do get some level of remuneration while they're going through, so that it's not the expectation that they are going to have to completely self-fund this or to kind of send themselves broke while they're doing their study. Is that I'll be honest, is that I don't think anyone ever does special needs dentistry to end up as a millionaire from being a specialist in that field. There's most certainly other specialties that where people would be able to recoup their costs quite significantly or more quickly than we would thereafter. But I think that what we have is we have a really rewarding specialty where you will go to work every day and feel that you've been able to achieve something good for the patients that you see. And that, as we know in dental care, is that it's in situations where you feel like you can look after your patients and just genuinely do so, is that often life has a way of kind of repaying you and making sure that those things are looked after. I'm trying to think if there's anything else that would be worthwhile people knowing. I guess it's that, look, I won't lie, it's a difficult course of study. It's meant to be challenging. It's meant to take you out of the mindset of a general dentist and transition you towards the mindset of a specialist. And I think that is a really interesting journey to go through. And while it has sort of these challenges and it is quite a significant workload to take on, the workload, I guess, to sort of break that down is usually about 50% clinical and the other 50% is more didactic and research related. Despite that being what would appear to be quite a significant commitment, my personal reflection, the reflection of most people that go through the specialty training, is that it's incredibly rewarding. Is that you go and you get to re-study an area of dentistry that you probably didn't get to touch on as much during your initial training. And because it's an area that you've chosen, everything's interesting. It's very similar, I guess, to us both working on the therapeutic guidelines, Steve, is that, we're asked about our interest areas and that there's a real passion behind it. So we don't mind going and exploring things in nitty-gritty details, because that really is what sort of helps us translate it to others. And so while it is a challenging course of study, the 3 years that I spent specializing, the people that I met along the way, the colleagues that I studied with, are all some of my closest friends now. And it was probably one of the most fulfilling things that I've done in my life. I would never go back and change that. And I see my job now is to really be able to help make sure that that's more sustainable for people in the future, through things like people getting levels of remuneration, looking at flexibility in terms of study arrangements for different people's life arrangements, potential for part-time study. Those are the types of things that we're looking at to try and improve the situation and make it more accessible for people moving forward.
Yeah, I can certainly understand the didactic part of that course, because when I look at the amount of academia you've been involved with, when I go through your CV, the number of papers you've been involved with, you've written chapters in books and various things, so covering an enormous spectrum of medical conditions. I think you've done a lot in the bleeding aspects, haemophilia and various things. Yes, there's a heck of a lot to know to treat this population. I think it's absolutely wonderful.
Really interesting thing about that is that you become the people that start to lead the way that we do things in dentistry. That's what is really quite amazing about an area like special needs, is that what makes it so unique in comparison to other specialties is that we don't have 100 years of history behind us, is that we're still learning the way that we need to do things now. And so the impact that you have and the change that you affect, or something as simple as the example of what you were talking about in terms of bleeding, Steve, is be able to think about how we manage patients with inherited bleeding conditions and how we can translate that knowledge to people who are warfarinized or on DOAC or who have other bleeding risk factors, and to try and then titrate that down to the level of the general dental profession and things that they can put in place. is the really, really interesting part about that. It's the creation of new knowledge. It's the creation of new ways to do things to improve the care that our patients receive, given that the reality is that our population is becoming more complex day by day. People are surviving for longer because of with more chronic medical conditions. They're on more medications. We live longer with our teeth, and we need to have more significant interventions despite the prevention. So it's not something that's going away. And so a really, really rewarding part of that is trying to translate what we do as a specialist sometimes to a general dentist so that they feel capable of doing the same things as well.
Yeah. You said it's not going away, and you're absolutely correct there. As life goes on, pharmaceutical medications that patients are on, polypharmacy is increasing. Geriodontics is, and I suppose that's a big area of special needs as well. I mean, it's just so complex with all of the medical conditions, with all of the medications. And it's not necessarily just in the older population, of course. We see a lot of this in younger. So I think there's a real need for dentists to be able to access this information, and because they're not just doing that crown on just that tooth's connected to the whole body. You really need to make sure that whatever you're going to do, whatever medications you're going to use, whatever local anesthetic, that you're thinking about these things.
And I think that that's the thing, is that, for the vast majority of people, those interventions would, are unlikely to have adverse effects. But in this population, as it can be so complex that sometimes it's the smallest thing. It's the smallest routine decision that you would make that can have quite an adverse effect. And I think that there is a lot of anxiety behind that in the dental profession. So I often joke, Steve, and say that if by the end of my career, if special needs dentistry is no longer needed as a specialty, then we will have achieved everything that we needed to do. The reality is it's not going away, because every time we solve one problem, there's a new problem that comes up. Is that every time we think that we've managed to figure out a protocol to manage a particular therapy, let's say, we've got it pretty down pat, how to manage patients who have head and neck radiotherapy, and most general dentists would know about that. All of a sudden you see proton therapy coming in. It changes the game completely, and it changes the parameters, and we need to find new ways to do things. So that is really one of the really amazing parts about being a specialist in special needs dentistry, is that you get to be at that cutting edge of dentistry. You get to do all the aspects of general dentistry that you've had a chance to do, but you get to do it in an incredibly complex population, and to work as part of the rest of healthcare in working out what the way forward is. And I think that it helps you put oral health in the spectrum as part of a bigger picture. But in comparison to working as part of a team in the dental profession, it allows you to feel like your impact is much, much more significant over a larger area of healthcare. And I guess, that my personal reflection of that is that often makes a big difference for the patient that's at the center of it.
Yeah, okay. Well, you finished your course. What did you go into then? Where did you go? Was it a mixture of private and public, or what?
So I did a combination of things. Is that I didn't take the fully traditional pathway of doing a 3-year DCLIN dent. I was strangely silly enough to sign up to do a concurrent PhD at the time. So a lot of that research that you've seen has been a continuation of that research that I started in my DCLIN dent. So I worked on my PhD part-time for another 3 years. I worked a little bit in private practice, but I also was then fortunate enough to get my hospital position at the Alfreds. You can imagine that this is quite a confronting thing, is that you have 3 years prior, you were a general dentist worried about what you were doing with sort of complex patients. You've done a 3-year course, and as soon as you have your testimonial, someone from a hospital comes to you and says, by the way, we have a retiring specialist. Can you take on the role of filling their shoes? They're 30 years of experience and the big shoes that they're left. And, I'm very, very thankful for the mentorship that Ian Hewson continues to give me in that space. But not only that, can you also then take on the job of being director of this dental service and leading our hospital in that area? But the funny thing is I think this is quite typical of specialists in special needs dentistry, is that the trajectory for growth over time is quite significant. Would I imagine that, now, only a few years after completing my specialty training, is that I'd be sitting with people like you on the Oral and Dental Therapeutic Guidelines Committee? No. Would I think that I'd be presenting submissions to government and presenting at major sort of international conferences about new research that we're doing or advocacy in these areas? It wouldn't have been on my radar, before I started my specialty training. But this is the work that we do. And it's so much more than just necessarily that aspect of clinical practice that a lot of other specialties are. it is a much, much bigger picture, and it's about contributing to this general message and trying to improve the system. So it is quite dynamic in that sense. And it is sometimes quite a scary trajectory of growth. But I think that what we've been very fortunate to have is, very senior mentors within our specialty, people like Sharon Liberali, Mina Borromeo, Laurie Walsh, who are these very wise elders that have an amazing level of experience and that provide the sort of guidance to a lot of us that are younger specialists to help us, to help us along our way, and to remind us that if we do have questions or we do have concerns, that there are the people to turn to. But I think that's the real benefit of being part of a small specialty, both in the Australasian context but the international context, is that we're quite connected. It's easy to reach out to people. People are very welcoming and very happy to help for advice. So it's very easy for me when I see something to email a colleague at Harvard or at Eastman College in London or anywhere across the world to get advice about different things, because this is what we do. And we are always stronger when we work together as part of that network than if we're ever working individually. And that's something that you learn very much so through I guess, the work that you do in special needs.
Okay, well, that's very interesting. Look, a question that I ask all the specialists is, can you take us through what a typical day looks like? Including even, like, do you have a morning routine, or, what time do you get to work? What structure is there in your day? So what, just so someone who's thinking about this has some idea of, okay, that's what's involved.
Yeah. So I guess, if I run through a typical clinical day, like yesterday was a typical clinical day for me at the hospital. So I tend to get up early. I'm a morning person, even though probably my partner wouldn't necessarily always agree with that. I like to get up early and I'd like to do some exercise first thing in the morning. So I'll either go for a swim or run or go to the gym. For me, it helps me start to process my day, and I feel like my brain is working a little bit better when I do that first thing in the morning. I usually get to the hospital quite early, so even though our patients will start often around 8:39, as though I'm usually there around sort of 7:38. What that allows me to do is to look through quite a busy appointment book to try and navigate with my team where the key pressure points are likely to be. What allows me to do is to preempt any particular areas where we are more likely to have complex patients or those that are more at risk of adverse reactions, so that we can try and prepare for those throughout the day and make sure that the day runs smoothly. It does also give me a chance to review any patients of mine that might be within the hospital itself. So rather than expecting them to come to the clinic, I quite like walking around the hospital and going to see them on the ward. So they may be patients who have had surgeries. They may have been patients who have seen in the previous week for different assessments or treatments. And it's just it's nice to be able to follow that medical part of things. On a Tuesday, we run an outpatient clinic at the Alfred. So it's a bit of a mix of things from 8:30 until about 4:35. It's a bit of a mixed bag. To give you an example, I started my day with a patient who came in who's had head and neck radiotherapy for a base of tongue SCC, who needed some teeth out because he had osteoradial necrosis around the lingual plate of those teeth. So part of what we were doing was removing those teeth and trying to debride that area to get that to heal. My day ended with a patient who has osteoporosis and is on zoledronic acid, who has an implant with MRONs around it. In between, there were a few haemophilia patients, a few sort of cardiac patients, and so it varies. Some of them were providing treatment to these people, medically necessary treatment before they have something major done. Some of them were assessments before that treatment. Some of them are follow-up care, but it's sort of quite fast-paced, and so that's what is quite nice, is that you work as part of a small team. I had my postgrad there who's doing special needs dentistry. We had a resident there working with us. We had a dental student working there, and so we just work quite dynamically as a team to sort of support each other through it. It's quite a fast-paced day, and it's quite a lot to handle in terms of sometimes the breadth of medical histories that are there. But I think that what is often good is that before we start the day, a few of us often sit down and we sort of talk through the patients so that we get a good sense of what's happening, so that we can all help each other out. And at the end of the day, often we have a quick debrief. So it's a nice chance for me as, I guess, a manager or a senior consultant in a team to check in with everyone to make sure that everyone's okay before they've gone home. If there's any questions, we can answer those, that you can sort of put to rest anything that was difficult throughout the day and to sort of park that, because I think that it can be hard, and dentistry can be challenging. We do often take a lot home with us. If something didn't quite go well in the way that we planned, if there was uncertainties, it's very easy for us to take that home and stew on it. So knowing that and knowing that people need a chance to rest, I think that's a really important part of what we do at the end of the day.
Yeah.
So
Can
that's
I
a
just,
clinical day for me.
well, that typical day of MRONJ patients, of someone who's had their head and neck cancer, of someone who's got major bleed, you've just described a day of hell in most dentists. They'd be listening to that in sheer terror and thinking, good grief, that one day would exhaust them. And that's a typical day. So much respect for you guys. That's absolutely incredible. And no wonder you need to do so much of the didactic training. That is really quite impressive stuff. So, look, we're getting towards the end, but just what is your, I think you've kind of said it throughout, but I just want you to sum up what your favourite aspects of being a special needs dentist are, and basically what would your final advice be to some dental student who's watching this, or a dentist who's thinking about going down that path?
So I think that I think the thing that I enjoy most about special needs is that I still get a chance to do everything that I would do as a general dentist. One of the things that really held me back from the idea of specializing to start off with is that I'd have to give up a large proportion of dentistry. We know in a lot of the other specialties, because they're very technical and they're amazing at what they do in those technical aspects of dentistry, is that you give up a lot of everything else. So let's say you want to specialize in endo, is that you give up being able to do crown and bridge and a whole lot of other areas that you might have enjoyed. Special needs dentistry doesn't ask you to do that. If anything, is that you get to do all of it plus more for a population that is incredibly thankful because of the barriers that they often experience. Is having someone there as a health professional who just understands their needs, where they don't have to explain their story again, is a really sort of quite personal and quite rewarding experience to be a part of. And I think that that's a really nice aspect of what we do. I can't remember your second question now, Steve, because I was talking too much.
Basically, what advice would you give to a dental student or dentist who was thinking about going down that path? I think you've kind of described the course quite well, but is there any final statements you'd want to say to them?
I would say that, if there's, we often joke in special needs that specialists have a special needs gene, is that there's something in life that, there's something within your DNA that means you're attracted to seeing people that are much more complex, whether it is because you have this passion towards social justice and trying to reduce inequities in health. It could be that you've seen someone personal go through something. And so that was probably partly it for me, is that I had family members that had quite complex medical needs. I had an aunt while I was going through dental school who had metastatic breast cancer, who was, was asking me questions about bisphosphonates at the time that we were still trying to figure out what was going on. It's little things like that sort of trigger it, and you think that if it is a real struggle for someone to see a general dentist in that environment, can you be a part of that difference in making that change? I would say that I would encourage all dentists, whether you're a dental student, whether you're a dentist that's working, that if there's any sort of inkling that you have that you'd like to be part of it, is just to reach out to any of the specialists that are close by. Spend a bit of time with them. The special needs dentistry is such a diverse area, is that not all of us work across all the areas of special needs. There's some of us subspecialize in certain areas, but often what we see that the factors that I talked about as quite discrete groups often overlap each other. A good example would be for a multiple myeloma patient, even though it might be primarily a medical condition, because of the spinal crush fractures that people often have in those situations, it can result in quite significant physical disabilities. And so you see the cumulative effects of this, and this is the interplay that we often see at a specialist level, that it's often not discrete groups, is that we see people coming with multiple of these factors. It can be challenging and it can be confronting, but it's a really supportive community. And if people are interested in any of those areas, I'd suggest that they just reach out to any specialist to spend some time with them. The specialists that I know are incredibly generous. But if people are pulled towards specializing, I think that what we will see in the near future is a chance for people to choose particular areas that they might be interested in without necessarily having to specialize in special needs dentistry. And it may be that dipping your toe in that particular area might be enough to then stimulate your desire to go and do something else, but it might be something partway in between. So I think that there are going to be lots of opportunities for that to be the case. I think lots of general dentists do an amazing job, and in our job as specialists to support them to do so. But I would highly encourage anyone who is ever interested is just to reach out either to me or to any of the other specialists about that interest, and then we can help navigate that discussion. But I found it incredibly rewarding. I find it rewarding each day to be involved in clinical practice, but also in the aspects of teaching and research that I do. I feel very privileged to be part of trying to improve a situation that sometimes gets stuck, and to have the patient at the center of that without having to give up any of the fun parts of dentistry that I enjoy as well. So it is, it's an incredibly rewarding specialty, and I would encourage anyone who has any interest to reach out and just to explore it further.
Okay, well, thank you so much, Matthew. That's a great summary of all of it. I have, and I'm sure most dentists have a tremendous respect knowing what you guys take on, because it's the cases that generally we feel like, no, we've reached the end of our skill level. And I also appreciate the level of knowledge that you need in your specialty there. I saw it at the Therapeutic Guidelines Committee meetings where you had an incredible amount of input, and it was wonderful to have you there. So I'd just like to say thank you, and appreciate you going through and explaining what it's like to be a special needs dentist. So thank you so much.
No, thanks for having me. And if anyone has any questions, they're more than welcome to reach out. I'm more than happy to have that conversation.
Brilliant. Okay, well, thank you so much. Bye.
Thanks.
Well, I hope you enjoyed that interview. It was fascinating talking to Dr. Mathew Lim about becoming a special needs dentist, and also what it's like on a day-to-day basis. Please remember to subscribe and like, and join us again in the near future when we continue our series. Bye.